Welcome back to another PSI video. Most recently, we have been working on a number of projects that involve protected health information, or PHI, also commonly known as personally identifiable information, or PII. This is information that's collected by various databases that collect information such as full names, social security numbers, email addresses, and much more. Anything that can really identify an individual. But what's important to know is that PHI and PII, the key differentiator is that PHI is used when talking about medical or health records. HIPAA legally requires that this information is protected, and so as a medical device manufacturer, it is important that you know and understand how to protect this information within your system. The U.S. Department of Health and Human Services has set a standard for privacy of individually identifiable health information, and it's often called the privacy rule. But this is a national set of standards that protects this information in all forms of media, and that could be verbal or oral, that could be paper, or what we're here to talk about today is electronic. So Elizabeth and Tim have sat down to discuss the various ways that we help our clients ensure that their devices and their databases and their systems are protecting that information so that they are compliant to this privacy rule. So Elizabeth and Tim, take it away.
Hey Tim, so as software engineers, we're responsible for ensuring PHI is protected on the devices and applications we design and develop. So here at PSI, we use a few different strategies to handle protecting health information. To start, can you talk a little bit about authentication?
Hi, Elizabeth. Sure. Authentication is really just the act of making sure that the person is who they say they are. So one way is just to use a simple username and password, which a lot of applications and websites already use. But if you want to get a little fancy with it, you can use multi-factor authentication, which typically involves having the user enter like their cell phone number, so then they can log in from their cell phone as well. So then that application can ensure from multiple facets that you are who you say you are. As far as authorization, that has to do with making sure the user has access to what they're supposed to have access to. So maybe like a low-level user can only look at things, where maybe a higher-level user can make edits to something, delete something, something like that.
Mm-hmm. And another buzzword in the world of app development and security is encryption. Is there any way that can be worked into protecting health information?
Absolutely. This is critical in protecting personal health information. So when you talk about encryption, that typically means one of two things: encryption at rest and encryption in transit. So encryption at rest is protecting data while it's physically present somewhere, like in memory, persistent storage, whereas in transit, you're going to want to use something like HTTPS, which is just HTTP with transport layer security to ensure that your data is encrypted over the internet.
All right, and another common way of promoting security in apps is having regular app updates. Can you talk a little bit about that too?
Sure. One of the main reasons for this is that you want to make sure that you're keeping up to date with any of the latest security vulnerabilities that have been discovered, any attacks, anything of that nature that you need to protect your users from, or your patient data from.
So a lot of modern applications are using the cloud. Is there any way to leverage the cloud to add a layer of security or to further help protect patient data?
Absolutely, Elizabeth. One popular way to do this is to add functionality to be able to remotely wipe patient data from a device. So there's instances where a device may be stolen or lost, where you don't want that information to get into the wrong hands. So this is a useful tool in that respect. One other thing is to just protect your data by having multiple instances of it. So a lot of cloud platforms actually provide the ability, some by default, to save your data in multiple locations to ensure durability of the patient data.
Okay, so those are just a few examples of how PSI implements strategies to handle protecting health information. Tim, do you have any other examples of things that are out there?
Yeah, actually, one simple example would just be only collect the data that you need. Um, for instance, maybe you're at the doctor's office getting your blood taken for some sort of test. When the blood is taken and sent to a laboratory for testing, maybe you want to use a barcode rather than actual patient data. So then the laboratory that sees that, sees the blood from the patient, can't associate that with anyone.
All right. Well, thanks, Tim, for taking the time to explain all this. We hope that you find this helpful, and if you have any questions, please don't hesitate to reach out to PSI.
If you found this video to be helpful and would like to learn more, or if you'd like to learn about another specific software development related topic, let us know in the comments below or send us a message at info@psi-software.com.